After an illness required Shirley Edelman to transition to assisted living, she and her family determined the best fit for her was to remain at home with live-in care. Despite an initial understanding that this would be covered, they began receiving large bills, prompting her son to contact Health Advocate for help.
I work for SAP, and I got lucky, and I happened to be sitting on a benefits call where they were discussing all of the benefits as to an SAP employee. And this one really struck me because at that moment in time I happened to be listening and not multitasking. They said that the Health Advocate benefit was not just for you as an individual employee or for your direct family members, but it was for your extended family. And that was just a truly fortunate opportunity for me to pursue. And as soon as I called Health Advocate and I said this issue was about my mom, there was not a moment's wasted.
One of the wonderful benefits at Health Advocate is that we work beyond the normal subscriber and dependents, meaning parent and children. We also help parents and parents-in-laws. So we're able to take the burden off of our members and work on their behalf, and that's exactly what we did with Mr. Edelman.
About 3 years ago, Mom took ill. So Mom was sick and she was fighting to get her health back, and then kind of put some of the burdens on her 3 children. And we all divide and conquer what's required to keep up with bills and doctors, and my responsibility was the insurance companies. Mom's a fighter, and she hangs in there, and she is our inspiration always, and she fought through this illness, and so then it became incumbent upon us to try to do everything we could for her, and to be able to keep her here in her apartment, keep her comfortable, and keep her be able to live in her single dwelling unit. And in order to do that, we really needed to have some of her funds returned.
All I can remember was that he submitted 3 different claims and each one came back denied, denied, denied.
And was I stressed?
Oh,
Very stressed, right?
yeah.
It took hours and hours of my time to be able to keep everything in order, and most importantly, try to make sure that her claims for services that were being provided would rightfully be covered. And it became too much just for me, and that's where Health Advocate came into play to help me be able to focus on my family, my job, while they took over the assistance of working very closely with the insurance companies.
Bill came to us with his mother's claims. She had several months of claims dating back as far as 2015. And what we had to do is kind of figure out what happened, looking at their bills, seeing what they have outstanding, and just make sure that everything was done correctly. And we had discovered there was an area of opportunity that we could fix.
Various calls to providers' offices, private physicians, collaboration within our team here for the best approach, completing spreadsheets. There was no job too small or too big for us.
And then through Health Advocate's tenacity, we finally received payments, but that was a relationship developed literally over about 18 months of working with Vera and Vicky, whose dedication was phenomenal. I would say when I do my job at SAP, I leave no stone unturned, and that's really where Vera and Vicky, I think, and myself connected, because they quickly took my mom's case on as if it was their own mom. And for me, that gave me a great sense of relief. I thought I was their only customer because the amount of time that they had to take to invest in my mom's case, and the number of calls, the number of follow-ups, the paperwork that had to be done, the experience to make sure they navigated correctly, it would seem like it was like a one-to-one. But when we met for lunch, it was amazing to hear how many customers they cover, how many companies Health Advocate serves with this offering, which is a phenomenal benefit.
I just thought, this is why I do what I do every day. It's not just something you can do without caring. We care about our members and we want to see the best possible outcome for them.
So once Health Advocate took over, I was actually able to enjoy our visit.
We play cards.
Who wins?
Most of the time you do.
And I say the opposite. Health Advocates made such a difference in my mom's life and my family's life. Anybody who would have an opportunity in a tight spot that they may be in, to work with Health Advocate, I think that they would find that someone's in their corner and that you do make a difference.